Heart attacks and strokes often come suddenly, with no warning. They kill more Americans than any other cause. 6 times more women than breast cancer. They have permanently impaired or disabled more than 3 million people in America. A heart attack or stroke doesn't have to happen to you. If you are at risk for a heart attack or stroke, this could save your life. It's called the Century Health Study, and you're about to hear how and why from the physicians who direct the program and from real people who participate in it. The study is directed by world-renowned cardiologist Dr. Lance Gould and his colleague Dr. Stefano Stringola. Dr. Gould pioneered cardiac innovations over the last 42 years, and this study is a culmination of everything learned over that time.
The biggest health problem in America now is vascular disease, yet we have the most advanced medicine, so there's a problem. The Century Project is designed to integrate the modern medicine with old-fashioned lifestyle control to prevent coronary disease, to prevent strokes. That means food control, weight control, exercise, support people, and then provide also the most advanced technology when it's needed.
Century Health Study is not a traditional clinical study. It's nothing to do with that. It's more of a mission. We do strongly believe that cardiovascular disease can be largely prevented, but we need to take action.
Gary had a heart attack in 1998 that he describes as a narrow escape. His wife Joan was with him then and with him now. Joe is a marathon runner in excellent shape and had no risk factors except for a family history. Even so, he had a quadruple heart bypass to avert a major heart attack before entering the study. Elena has not had a heart attack, but had coronary artery blockages that required 3 stents in 2006. Dorothy has severe risk factors for cardiovascular disease and a very troubling family history. She herself had a small stroke. Kathleen was slim, healthy, and relatively young, but before joining the Century study, she had had a stroke. They have all graciously agreed to share their experience with you.
Heart attack is the sudden rupture of a blood vessel, of a plaque inside the blood vessel in your heart. You form a clot, and suddenly there is lack of blood supply to your heart muscle.
It happened. I mean, no, there was no anticipation whatsoever.
I did not have any advanced warning of heart trouble or anything. I exercised. I tried to eat well. I was not overweight, and all of a sudden there it was.
Knowing that my dad had heart problems, of course, when I would go and get a yearly physical, I was in excellent shape. I mean, you know, you would never know that I had heart problems.
It was kind of like a car wreck. You know, it happens so fast that you really get scared when it's over with, and you realize how close you came to dying.
You always think it's going to happen to somebody else, but not you.
And people say, well, I prefer to die of a heart attack. These days we are so good that we can keep people alive. And sometimes being alive after heart attack is not much fun.
And I always had this lingering fear that it would happen again, and that I had no control over it, and that was just the way my body was, and that it was just like a time bomb.
So just thinking that I might lose him was the scariest part for me.
Dying from heart attack, I think, is scary, because I'm an active person. If I got crippled, I would be sad, very sad.
Nobody wants to die, but you don't want to live your life being a vegetable either. The common things with a brainstem stroke, if it's severe enough, is that you can just be totally immobile except for your eyes. That's pretty scary.
The scariest thing to me is, what is it going to do to me? Can I be able to function again?
This tragedy is avoidable, is unnecessary, preventable 90% of the time. We know that, and we need to stop it.
When you enroll in the study, and at certain points thereafter, you'll have an evaluation that includes a stress test and a PET scan. In between, your clinic visits will include physical examinations and consults with your team, including your dietitian, your nurse specialist, and the cardiologist.
The purpose of the team is so that nothing is overlooked. And there's a lot of support for the food, the exercise, and the medical management.
Oh, I so look forward to the visits. It's really nice to be able to spend one-on-one time with a dietitian. I mean, when does that happen? And the nurse, and also with the physician.
Well, you know what, I want to say this, that over my years I've been to a lot of doctors, and another aspect that has really made the difference for me here is the personal attention.
This program that we have here is not an experiment, it's a strategy. We need to apply this strategy to prevent disease, conditions. It is all possible if we start living a smarter lifestyle.
The PET scan is one of the hallmarks of the study. It's an imaging technique developed and refined over several decades by Dr. Gould. It shows whether your heart is receiving an adequate blood supply.
PET images show blood flow in the heart in a very precise quantitative measure. That number is what determines whether your heart lives or dies.
You have these pictures. Red is normal, but when you see the color that changes, becomes gradually yellow or green or blue, indicating worsening severity of the blockages, then I share the pictures with the patient and you can see it.
There was no doubt about it. It wasn't listening with a stethoscope. It was a picture. It was a visual image of what was going on.
When I see my PET scan, I was really impressed. And I was so glad to see that looked like normal, not so bad like what I was expecting.
When I saw the PET scan, I was so excited to find out that it was a very, very good scan, that there is no heart disease. That took a lot of stress off of me.
The PET scan was like looking at my life, because I had would have had some blockage by now if I had not had the PET scan and treated it.
In the Century study, we use PET scans for two purposes. One is to identify people that already have such advanced disease that the lifestyle alone or the drugs may not be enough to prevent a heart attack. So the PET scans identifies these people specifically who will benefit from bypass surgery or stenting procedures with a catheter. We also use PET to be sure who doesn't need these procedures. Some people come to us with these procedures recommended, but they have good blood flow in the heart. They don't need the procedures. So the PET has been very important for selecting out the patients that need or do not need these invasive procedures like bypass surgery.
The dietary consult is truly vital. If I have to point on one thing that really makes the biggest difference among all the interventions we are doing, is about the diet.
When I first started meeting with the dietitian, it was just so much of an eye-opener to find out that what I thought I was doing so good, I was doing all so wrong.
I would have had a heart attack by now, because eating what I was eating, my arteries would have been clogged up.
I've dropped 3 clothing sizes. I have energy that I didn't have before.
The aim of the century is not only to prevent death, but actually improve quality of life, and that's actually even a more possibly important part of it. Because when people lose weight and exercise, they feel better. There's less depression. They take less meds. Their whole health and well-being is better.
As we get older, we think that we're getting slower because of our age. And since I compete, I thought, well, I'm getting slower on my running because I'm getting older. But I realized what happened to me. I lost about 20 pounds, and I gained some of that speed back that I had lost.
It made me just like, you know, just a change in life, you know, like I became a 64-year-old, just alive grandmother.
He's more energetic. Before, he used to complain about being tired quite a lot and didn't really feel like doing anything. And now we're always doing something.
I have so much more energy. It's like I feel like I'm alive, you know, just really alive.
So I have become a better triathlete now. I'm running faster than I have probably since I was 60 years old.
Since I joined the study, my PET scan is getting better. It really helped me to keep myself healthy.
It actually saved my life. I feel like it saved my life.
Since Gary's been on this study, I feel like we're going to live a long, long, healthy life.
That is a change that is going to be with them a lifetime, and is going to be within their family for a lifetime.
It's great to join this group study. It will help you a lot.
To improve your health, quite often you have to get scared to death. I hope other people don't have to get as frightened as I do. I hope they don't have to go through a heart attack to make them want to do this.
If there's someone you love very much that you know could benefit from this study, I encourage you to encourage him or her to make an exploratory appointment here at Century.
If you have risk factors for heart disease or stroke, or think you might, don't wait to have a heart attack or stroke. If you've already had one, don't wait for another one. Call or go online today. See if this program is right for you or someone you love.